What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you're seeing this channel, don't forget to subscribe. Welcome to Zima moto series, and today we're going to discuss about the orbit. And the orbit is a bony framework that is housed in the eye. This is your orbit. 7 bones of the skull come together to form the orbit. And then out of these 7, 3 are cranial bones and 4 are fascial bones. What are the cranial bones? That's your frontal bone, the sphenoid bone, and the ethmoid bone. These are the cranial bones, and the remaining are fascial bones. So the frontal bone is forming the superior orbit, the roof of the orbit, and then the sphenoid forming most of the posterior wall of the orbit. The medial wall is contributed by the ethmoid bone. You have the lacrimal bone, and this tiny bone over here, which is called the palatine bone. So you also have the maxilla, which is forming the inferior anterior wall of the orbit, and laterally you have the zygomatic bone, which is also called the cheekbone, forming most of the lateral wall. So what is so important about this discussion is about the foramen and fissures. This is worth noting, worth remembering. So you have optic canal here, and the optic canal is for passing of optic nerve and ophthalmic artery, and then you have a slit between the greater wing and the lateral wing of the sphenoid bone. And this is called the superior orbital fissure. Now, while go through the superior orbital fissure, that's going to be cranial number 3, number 4, number 6, and the first branch of number 1, together with a vein which is called the superior ophthalmic vein. And then remember the ophthalmic artery is going through the optic fissure, optic canal, but the ophthalmic vein is passing here. Now you have another slit because the superior you also have inferior orbital fissure, and the inferior orbital fissure is going to be between the maxilla and sphenoid and zygomatic bone here. And what goes through the inferior orbital fissure is actually the maxillary nerve, and the infraorbital vessels. Okay, so you have maxillary nerves giving the infraorbital nerve, and the infraorbital nerve the passing through this groove together with the vessels, the infraorbital VAN, and then they're going to pass through the infraorbital foramen here. This is the infraorbital foramen that goes through the infraorbital foramen. Is going to be your maxillary branch of those vessels and arteries. So because of infraorbital foramen, you also have the supraorbital foramen. The supraorbital foramen is for the supraorbital VAN. The supraorbital VAN, they are related to ophthalmic artery and nerve. The infraorbital VAN, they are related to maxillary nerve and artery. And that's a rule to remember. So this is what I was saying. So you have optic canal. Two structures are passing through the optic canal. You have the superior orbital fissure. These are the structures that are passing through the superior orbital fissure, and then you have the inferior orbital fissure. So this all is the superior orbital fissure, and then you have the inferior orbital fissure, and you know what goes through the superior orbital fissure. So this is a little summary for you. The structures that are going through this canal. So you have for example, trigeminal nerve is only V1 that is going through superior orbital fissure, and has got 3 branches that are passing through superior orbital fissure, and these are the branches of V1. You see, you have the lacrimal nerve, you have the frontal nerve, and the nasociliary nerve. And the frontal nerve is gonna give the supraorbital nerve and the supratrochlear nerve. This is supraorbital and this is supratrochlear foramen, and this is for passing all these structures. Okay, guys, see you soon.